Hi, Paul Boehnke here. Taking care of ourselves and living the fullest life possible is not the easiest thing to do in this complicated world of ours. So having a team of people that help us on that journey is really pretty important. Today, I want to introduce you to a friend and a colleague of mine who also happens to be on my own team of healthcare practitioners. Dr. Jacob Panka is a naturopathic doctor, and I've invited him here today to talk with me a little bit about what it is that he does. So first, welcome, Jacob. Glad to have you here.
Thanks, Paul.
Now, I know that naturopathic medicine is either more or less well-known in various parts of the country and the world. And I'm just wondering, would you tell me a little bit about what it is that a naturopathic doctor is and why people might seek care from one?
Thanks, Paul. We, as naturopathic doctors, we're trained in primary care.
Mm-hmm.
So we have a lot of the skills and background that your standard doctor, your Western doctor would have.
Yeah.
But what we do is we offer additional solutions and options. We have natural approaches to health, natural ways to treat disease that your primary care doctor wouldn't have received as much training in. We get additional training in nutrition, how to make diet lifestyle modifications, evidence-based application of dietary supplements and herbal products is really where we shine out. We have the experience treating with pharmaceuticals, but in Minnesota, we're more focused on the natural side of things and being, another part of the care team, like you're saying. It takes all of us. I'm not a one-stop shop for everything medicine, but in terms of the natural options, that's what we have to offer.
Oh, great. That helps understand a lot. That it's very similar to primary care, but it's sort of really focused in helping things from a natural point of view to begin with. Yeah. So when we think about the team of healthcare practitioners that we might assemble for ourselves, how is it that you see sort of naturopathic medicine fitting in alongside all the vast array of other practitioners that we might use?
Yeah, I like to look at us as ideally that first layer. If you would come to us, initially, we could help you sort through what you might expect from a primary care doctor, how to best utilize them, and also different options that you might have to support disease and allow your body to heal itself. Put yourself in a position where you might not even need to proceed to that next level, where you're dealing with specialists, you're talking about initiating medications, or maybe even receiving surgery. There's so many other natural options to try first. So we like to, ideally, we're that first stop, but that doesn't always happen. Many times people, they've gone through the rigmarole with Western medicine. They've exhausted their options, or maybe they're not satisfied with those options, and they're coming to us for a second opinion or just a new approach.
Yeah, absolutely. Great. So I'm kind of curious, we all have unique journeys that have really gotten us to where we are. And I'm curious about why you became a naturopathic doctor.
The pivotal moment for me was in college. I played football and I studied neuroscience. Those things were a little at odds. And I started to realize that. I eventually left football before my senior year, having discovered the potential consequences of repetitive concussion. A lot of this information was just coming out at the time, and I started looking for answers. And this was kind of a pattern that I had felt when I approached my Western or my standard care over the years. Was I didn't always get the answers I wanted. I was never quite satisfied with they were more focused on, I had a ligament tear in my knee, discussions of concussion. They didn't have anything to offer me. They were like, it's emerging, we don't know. So a lot of research into that topic led me to naturopathic medicine because they offered preventative, supportive options that I could implement right away. You know, it wasn't just this or nothing. It was, you know, look at this huge array of options that we can do to support your brain health. And I was like, wow, this is satisfying for me.
Mm.
This is this is what I want to do with my life.
Yeah, great. It sounds as if that from, compared to traditional Western medicine, which has a tendency maybe to focus on surgery and drugs, not exclusively certainly, but there's that tendency that it sounds like you're drawing from a very wide range of options in terms of care and helping people.
Absolutely.
Yeah.
Yeah, I really am passionate about that because there's not a one size fits all approach for medicine. You know, you need to involve the patient, you need to involve their preferences, and having all those options and tools just makes it that much easier.
Absolutely. So can you tell me a little bit more about how really your services sort of differ from the traditional primary care doctor?
Well, I was trained as a primary care physician in Oregon. Naturopathic medicine varies a little bit in scope from state to state. Most of the differences lie in that holistic approach that we have. Our initial appointment is almost 2 hours long. We have extensive paperwork that we have you fill out ahead of time that allows us to get familiar with your case even beforehand, get to know you as an individual. Your primary care doctor will have kind of standard lab tests that they work with, and we kind of color outside the lines a bit. Research, while it's valuable and we use these evidence-based principles in our practice, oftentimes the research kind of lags. There's new knowledge that's out there that is very helpful, but it hasn't made it into the standard of care. It isn't widely accepted. So it's something we call like functional lab testing. So we have these kind of, these panels that we can utilize that kind of give us more information than your insurance company really allows your primary care doctor to obtain. They don't find it as useful, but a lot of times that information is how we get results and really set ourselves apart from your primary care doctor.
Yeah, and actually that's part of the experience that I personally had with you as well, through some blood tests that you had asked for a few other little tests that my other doctor had not, and discovered something that was kind of important for me. So yeah, absolutely. So tell me, Jacob, what sorts of patients do you really love to work with the most?
Patients I'm most passionate about working with have heart disease, neurological disease, they have digestive concerns. That is my strength, is those. But I also trained as a generalist. I'm a trained primary care physician, so I have that background that allows me kind of work generally to address all my patients' concerns.
Great. Well, Jacob, thank you so much for taking time to talk with me today. And I know that you've already probably helped many people understand more about what it is that you do. And I'm wondering, how can listeners really find out more about your practice?
I would check out our website at pankanaturalhealth.com. We have a blog and a lot of material to look through to learn more in depth about what is a naturopathic doctor, what do we do, a lot of more specifics about how we treat Alzheimer's, more of the founding principles of naturopathic medicine. More of that detail can all be found on our website. You can also look at naturopathic.org, which is the American Association of Naturopathic Physicians. They have a ton of resources, and you can also search for a naturopathic doctor there. Hopefully you end up finding me in my practice here.
Right. Well, I will certainly include both of those links here with this video. Thank you so much again, Jacob, and I hope to talk to you again soon.
Sure thing, Paul. Thanks. Looking forward to future conversations.
Great.